Do you worry that you worry too much? And do you ever worry that you may have a real anxiety disorder? If so, stick around and you want to watch this. My name is Sulman Mirza. I am a psychiatrist, board certified in adult psychiatry and child adolescent psychiatry, and I'm going to teach you how to evaluate for anxiety disorders. Anxiety disorders in America are one of the most common psychiatric disorders. It can affect up to 30% of Americans. Oftentimes, these things show up in childhood and adolescence, and sometimes even before then. The most common anxiety disorder is a specific phobia, followed by social anxiety, then panic disorder, and then we also see generalized anxiety disorder. The DSM-5 in 2013 changed some of the ways that we classify some anxiety disorders. So PTSD, or post-traumatic stress disorder, is no longer considered an anxiety disorder, and OCD, or obsessive compulsive disorder, has its own category now as well. In this episode, we're going to talk a little bit about how we evaluate for some of our anxiety disorders. When we're talking about anxiety, we have to understand that anxiety is a adaptation, a survival technique that is there, that's developed over time in order to help us. When I talk to my patients, I give them the example a lot of the time that thirst is an anxiety in a way. Our bodies require us to have water, so they create this feeling within our body that says, go get a glass of water or go drink some water. When we're talking about anxiety, I always bring up what's called the anxiety versus kind of function curve. If we have in our lives no anxiety, we have nothing that's pushing us to do something, then nothing occurs. But what happens is we have anxieties that are there, such as paying the bill, getting good grades. So that makes us get up out of bed, go to school, go to work, function, do whatever it is that we need to do. We ultimately find what is an optimal balance between anxiety and performance then. So as our anxiety reaches a certain level, our performance will match that, hopefully. The problem occurs is when the anxiety causes too much of an issue, so much so that our performance then suffers. And everybody has their kind of optimal window of what works for them. And again, when we get pushed out of that window, performance drops off. And that's when we see what we call clinical anxiety disorders. Specific phobia is pretty simple, right? And it's related to a specific object or a thing. So something like arachnophobia, which would be a fear of spiders, which again is going to be higher than what would be quote unquote normally expected. Public speaking, one of the most common. Fear of heights, spiders, bugs, these kind of animals, dogs, those things. People can have a fear of these things. And again, that's more of a specific phobia. And people are able to very easily kind of identify what they are. When we talked about generalized anxiety disorder, it's in the name in itself, right? A specific phobia is for something very specific. A generalized is more for worries as a whole. We ask people, do you feel like you worry too much? And that's the first kind of thing that they have to have, is a feeling of that they're worrying too much. There also is the control. There's the aspect of feeling like I can't control how much I worry, and it's out of my control and it's overtaking my life. There also needs to be some symptoms that come along with it, oftentimes a physical aspect of the anxiety. So feeling of restlessness or feeling keyed up or on edge as if something's about to happen. Feeling like they worry so much that it wears them out and it fatigues them. Worrying to the point that it affects their concentration and can make their mind go blank at times. Worrying to the point of being irritable. Worrying to the point of having muscle tension. So I'll ask people, do you ever feel like your shoulders get really tight? You clench your fists, you clench your jaws really tight, and also potentially a sleep disturbance. We worry so much that we're not able to sleep, or it wakes us up from sleep. Social anxiety is a little bit different, and it's more so in regards to the anxieties that people may have about being out in the world, being in public, going places. And the main thing that's there is a feeling of embarrassment. People with this disorder will try to avoid social situations as much as possible. They'll find ways to get out of it. And a lot of it is due to a fear or a concern of being embarrassed. People will often say to me that they have a fear that people are talking about them. And it may be a sense of paranoia, but the paranoia is about, again, people talking about them, saying things about them, people judging them all the time. Panic disorder is the other kind of massive anxiety that's there. When we talk about panic disorder, the main thing we're looking for is the presence or absence of panic attacks. Panic attacks can be part of other anxiety symptoms, but the main thing with panic disorder is that the panic attacks create a fear of having a panic attack, and then somehow our functioning is changed or modified in order to mitigate or reduce the risks of having a panic attack. There are physical and mental components of a panic attack. People will talk about having trouble with breathing, hyperventilating. People will describe a sense of choking. People will discuss palpitations, a pounding chest. People will discuss temperature sensations that are changing. So they'll have feeling really hot, then there'll be chills, but they'll also feeling kind of numb and tingling as well. People will also discuss potentially pain in their chest, feeling like an upset stomach, like they're gonna throw up, feeling dizzy or faint or lightheaded. Some of the mental components that are part of a panic attack is feeling like they're detached, feeling like they're not really there, feeling as if they're watching themselves, a fear of losing control, like they're quote unquote going crazy. Or also they'll have a fear of something like they're going to die. And this is what precipitates a lot of people going to the emergency room to get an evaluation when they're having a panic attack, because they're feeling like, oh my God, I'm having a heart attack, I'm dying. Panic attacks can also be due to escalating anxiety. So someone's in a situation where the anxiety is building up and then it ultimately culminates in this panic attack, or they can occur out of nowhere. So people can be sitting around minding their own business, and then all of a sudden, boom, a panic attack hits. When we're evaluating for anxiety disorders, it's really important that we ask about all of these. Typically, when I'm doing the evaluation, I start talking about generalized anxiety disorder, then I go on to social phobia or social anxiety, then I go on to panic disorder symptoms.